Individualizing care for people with diabetes? What a novel thought. Hello, Nation. Today we're going to talk about individualizing care for people with diabetes. Very recently, the American Diabetes Association and the American Association of Clinical Endocrinologists put out treatment guidelines for healthcare professionals on how to treat their patients with diabetes. And the big buzzword this year is individualization. And I say, really? What a novel thought. We should take patients' individual differences when we're designing an education and treatment program. Give me a break. There's so many differences you have to think about when we're treating folks with diabetes, and all of you have to be an active player. There's cultural and ethnic differences, personal beliefs, there's the living situation, whether you're living alone or you might be homeless, your level of education, and also, very importantly, your financial situation. Do you have health insurance? These are important factors when designing a treatment program for people with diabetes. And by the way, I'll say this again later on, it's extremely important when designing an education program. And that's what we do here at Taking Control of Your Diabetes. Now, once a treatment program gets instituted, you got to really figure out how aggressive you should be. And there are many factors that make a difference. What is the age of the patient? How long they've had diabetes? Is there heart disease already? Are there microvascular complications such as eye, kidney, or nerve disease? Because all of these complications may change the way a professional treats a patient in terms of how aggressive their hemoglobin A1C should be. Also, is that person at risk for hypoglycemia? And do they have hypoglycemia unawareness? The other thing that's extremely important and forgotten about a lot, I call it, part of the diabetic care puzzle that's missing is that you've got to individualize education to the family members, the significant others. They're the ones that are the support system. Doctor can't follow you around 24/7. So not only does the patient have to be approached in an individualized manner, but their support system as well. So the overall theme of Taking Control of Your Diabetes ever since 1995 is basically you need to be the most educated person on your team so you can have a really efficient and good conversation with your caregiver to get the best care possible. You've got to get motivated and put diabetes high on your priority list. And remember, you are your own advocate. No one else is going to push for diabetes care more than you should. So long, Nation.